Okay, so we're just going to review the physical exam of the right shoulder in an athlete with some shoulder pain. Okay. So first thing you can do is have to take your shirt off. While he's doing it, I'm watching this. How does he move? Is he comfortably? Is he protecting the arm? There's a lot of hesitation. So you can just go through the typical inspection. You start with the sternoclavicular joint, come out around the clavicle, out to the AC joint, which if you're having trouble feeling it, you can just find the collarbone, follow all the way out until you feel a little flare of the clavicle. There's usually a little ramp right here. You can press right on it to see if it's tender. It is an AC joint. With his hand resting in his lap, this primary insertion of the rotator cuff, the supraspinatus, is going to be right about there. So you see if that's tender, and the bicep is going to be just around the front of the shoulder, even in just a little bit right in there. To feel the bicep, I'm rolling the arm in and out. You can feel the bicep tendon rolling back and forth under my thumb. And the coracoid is right next to that, so I check there as well. Okay, so you can go AC joint, rotator cuff, and then the bicep tendon, all within a centimeter or two of each other, and then the coracoid over here. Okay, so now we're going to check range of motion. So both arms out to the side, all the way up to your neck. All the way up. Good. And down. Good. Hands like this. Rotate out. Good. Can you bring your arms up and out there? Okay. How far back can you reach? Just go one at a time. Okay. And then do that with the other one. And in this position, I'm checking to see not only how high can you get his thumb, but also what happens with the scapula. So, okay, so if you look at the scapula here, now go ahead and switch back to the other one. And you can see this scapula pops out a little bit more. All right, good. Now we're going to progress to checking the strength. So start with elbows in tight. The natural tendency is to wing the arms out. So you can tell the patient, keep your elbows in tight, and now push sideways against me, push outwards. Good. So I'm feeling how strong he is against the sustained push. I'm also watching to see if the scapula moves. Some people will tilt their scapula up. He keeps his low. So we'll push out. Good. And I go right to decant testing. So push up. Again, I'm watching to see if he hikes the scapula. Go ahead and hike your scapula for us. Here you see some people do that if they're trying to protect the painful supraspinatus. Right, now for this position, I check the external rotation, put in the flexed position. Put the patient right here. This is called the hornblower's test. Push up against me here. Again, checking to see what happens with the scapula. Then I'll go right to part of the O'Brien's test. Push up. Good. And now switch from the palm up. Push up. Good. Then we can go right to the speeds test. Elbow straight, pushing up. Good. And I'll often check just one more position out here. Go ahead and push up. Good. Now from here, it's easy to test the impingement signs. So come up. Notice I've rolled the thumb pointing down. I come up from the ceiling. I've got my hand on the scapula to hold the scapula down. See if he's painful in that position. If he is, then I immediately turn the palm up and repeat the same maneuver to see if he's painful there. If he's painful with the internally rotated position but not the externally rotated position, that's a positive impingement test. The other impingement test, called Hawkins impingement test, is putting the patient in this position and then internally rotating the arm. This brings the greater tuberosity up to the underside of the arm, just rotating in this position here. I'll often do one other test to check how tight the posterior capsule is. I tell the patient I'm going to give him a hug. I put my arm behind him here to stabilize the scapula and chest, and push him across like this. If there's pain in the front of the shoulder, in this area in here, it usually means that a lesser tuberosity is impinging on the coracoid, or it can indicate some biceps tendonitis or something like that. One other strength test is the belly press sign. Put the hand here, elbow up in front, don't let you pull. Good. That's to check the subscapularis, followed immediately by the bear hug sign. Again, a subscapularis test. Push down. Good. Okay. Now we're going to check that you see for capsular tightness or instability testing. So we'll have you lie down on your back here. This requires a little bit of practice. So scoot over to the side. Good. I want the scapula at the edge of the table. Now, I'm going to use my thigh to keep his arm in the roughly horizontal position. I don't want him dropping back this way. I also don't want him up like this. So I'm going to let his thigh rest, or let his leg rest, or let his arm rest on my thigh. I stabilize the front of his shoulder, and then let him externally rotate. You get a good measure of his true external rotation. Also, this is how you test apprehension at testing. I'll have him come up. If he gets any discomfort or sensation of apprehension, I'll then put posteriorly directed pressure on the front of the shoulder or on the upper arm. Okay? I'll then try to provoke a little discomfort by getting my hand behind the humerus and pulling anteriorly to see if that provokes a sensation of discomfort or instability. Then I'll check to see if he has a tight posterior capsule, just reversing the rotation. Again, stabilizing the scapula in the front of the shoulder, again with my thigh behind his elbow, and doing the internal rotation. A test right here to see how tight his capsule is. And then we'll check his posterior capsule coming across the chest. Notice if I don't stabilize the scapula, notice how far the arm can go. It's almost completely free, unrestricted. But I'm going to stabilize the scapula. I tell the patient at this point, I'm going to stick my hand in your armpit, because otherwise they can be a little creeped out about it. So I go ahead and grab hold of the scapula here. Notice where I have my elbow. I have my elbow on my iliac crest. So now I've got a real good leverage point to hold his scapula still as I push him across. I don't want to let his hand rotate up. I want to keep his hand directly across his chest. So I'm holding the scapula as I'm pushing across. Okay? And the final check here is to check for posterior instability. Just getting him to relax. I'm just pushing the humeral head posteriorly on the glenoid. The textbooks say to put them in this position and push. I don't find that to be that effective. I find it to be a much easier test to just get the patient to relax in essentially the scapular plane and then push posteriorly. And of course, you have to repeat these tests on the other side. So sit up for me. We're going to run through the whole exam from start to finish so you can see how long it takes. Okay? So presume you take your shirt off. All right? Go ahead and check along the clavicle. Get to the AC joint. Greater tuberosity. Bicep. Rotating the arm so I can feel the bicep move under my thumb. And then on the coracoid. Okay? Now, hands like so. Push outwards. Good. Push upwards. Good. Push upwards. Good. Push upwards. Good. That hurts him a little bit. You have to pop. Go ahead and push up. Does that hurt? So that's a positive O'Brien sign. He had pain in the first position, but not the second. Speed stats. Push up towards the ceiling. Yeah. Push up again. Yeah. We go up to the impingement test. Any pain? No? Okay. If he did have pain, then we'd have to repeat it in this position here. Now we go to the obvious maneuver. Just come right there. Okay. Right here, elbow here, doing the belly press. Don't let me pull. Good. Right here, don't let me push up. Good. Okay. Now, if you can lie down on your back. Good. I'll bring him out here, supporting his arm with my leg. See if there's any discomfort there. Let the arm come up higher. Sometimes instability is provoked in this position rather than down here. Go right to internal rotation here. Good. I'm going to stick my hand in your armpit. And you are tight in this position. You can probably feel that stretch. Yeah. All right. And now we check. So relax here. Just got to let it go real loose. This little maneuver I learned from my physical therapist friends. Just getting the arm to relax just by swinging it and then pushing posteriorly. Okay, now scoot over this way. And we just check the same things over here. So the rotational tests, of course, are very important with throwers. It's really important to check the rotation with throwers as well as the cross body. He's tight on both sides. All right, so relax. You scoot toward me a little bit. Good. Okay, we're done. So that's it. That's a routine examination. There's some more specific tests for specific injuries that you might expect, but by and large, that covers about 90-95% of what you need to examine in an athletic shoulder.